can you introduce yourself and tell us a little bit about what you do in your day job?
Sure. Well, as you know, my name is Jehannine Austin. I am a professor of psychiatry and medical genetics at the University of British Columbia in Vancouver, Canada. I also, though, I think it's important to say right up front that I live with mental illness myself. So I have both depression and anxiety, and for the record, nightmare disorder, which is a particular problem in the context of the pandemic. So I think the motivation that I bring to my research is very, very personal for me. So I'm a genetic counsellor by clinical training, and I guess we're probably going to talk more about that today. And my PhD is in the genetics of psychiatric illness, so trying to find genetic variations that make people more vulnerable to developing conditions like schizophrenia, bipolar disorder, that kind of thing. So yeah, it's really nice to be here. Thank you for having me.
Lovely. And I think it'd be a really good place to start to talk about what we do and don't know about the relationship between our genes and mental health, mental ill health, mental disorders. So what do we know and what don't we know?
That's so yeah, let's not start with a small question, hey? Okay, so okay, I'm going to take a little bit of a historical perspective on this, if it's okay. Because I think it provides an important framework, right? So, you know, for a very long time, for decades, we have engaged in asking questions about psychiatric illness that would be, you know, is it nature or is it nurture, right? We tend to get very binary in our thinking. We tend to get very, you know, it's, you know, very definitive one or the other types of thinking. And I think that that's been profoundly unhelpful. It's a very human thing to do. We tend to want to understand things in the simplest way possible, but sometimes we can oversimplify things to the point where it no longer makes any sense. So there's an amazing quote by a psychologist, Hebb, who was asked once, I think it was in the 60s, about what contributes more, what matters more in the development of psychiatric illness. Is it nature or nurture? And he said famously and beautifully, he said, well, that's like asking what's more important to the area of a rectangle, length or width. And so I think that, to me, that sums it up beautifully. So what the understanding that we've arrived at, and that we've had sort of fairly robustly for some time now, is that psychiatric illness is not caused by nature. And I don't like using that word because it sounds so like immutable and doomy and that kind of thing. So I prefer to just say, you know, what we understand is that there's a genetic contribution. And then in terms of the nurture part, I also hate that for many reasons. Amongst them, you know, when we say nurture, it sounds like what we're talking about is parenting, right? That it's how you were raised that is the problem. And even more specifically, we rarely involve dads in this narrative. So usually when we're talking about nurture, we mean mother blaming. And so, as you know, there's a really strong history in psychiatry, unfortunately, of mothers being blamed for their children's psychiatric illnesses. So schizophrenic mothers has been a thing. I mean, you know, we still see women now in their 60s and 70s who are told that kind of thing, you know, earlier on in their lives. And then, of course, for autism, you know, there was the refrigerator mothers idea. So it's never dads that are blamed for this stuff, it's mothers. So anyway, I hate nature as a word for referring to this because it sounds so immutable and kind of hopeless. And I hate the nurture part because it's about mother blaming. So when we're talking about this stuff, I prefer to talk about genes and environment, or genes and experience, if you prefer. And what we know at this point is that it's not one or the other. What we've come to understand is that these are conditions that arise as a result of those things all acting together in a combined way. And this makes intuitive sense, really, if you think about it, because, like, you know, our experiences can't possibly act on us in the absence of our genetics. Like, that's not a possibility, right? So there has to be some degree of interaction there. And so what we know is that it's genes and environment working together, or genes and experience working together. What we don't know is what all of the specific gene things and all of the specific experience things are, right? So we know broad strokes. What we don't know is all the specifics and how much each of them contributes and all of that kind of thing. So we understand the principles, we don't know the specifics, is really what I would say. Yeah. Okay. That was a very long answer. Sorry about that.
No, that's a really good start. So when we're thinking about public mental health, and when we're thinking about preventing poor mental health,
yeah,
then we tend to, I suppose we think about two things. We think about people who are most at risk,
yep,
and we think about, you know, risk and protective factors. Is that something that you think genetics can and should contribute to?
Absolutely, David. Yes, I do. So when we're thinking about what we know about increased risk for psychiatric illness, one of the things that we know about is that family history can play an important role. That is not because psychiatric illnesses are inherited. Psychiatric illnesses are not inherited, right? Mm-hmm. But what we can inherit is a vulnerability to psychiatric illness, right? So we know, for example, that if you have psychiatric illness in your family, you have a higher chance than people who don't have psychiatric illness in their family to experience these kinds of things. So it's by no means the case that, you know, if you have a family history, then you will get. That's not it at all. Not at all. All it means is that you've got a varying degrees of increased chance over other people who do not have a family history of mental illness in their family. Yeah. So I do think that's an important part of things. But you also were talking just now about prevention, and how that might play into it. And I wouldn't be surprised. In fact, I hope some people who might be listening to us talk today are thinking, I don't get it. I mean, how is genetics important if you're trying to talk about prevention, because you can't do anything about your genetics? And that's a fair point. So let's recall what I was just talking about, right? That it's not just genetics, and that all you can inherit is a vulnerability to mental illness. You don't inherit mental illness itself. So the other bit that contributes to mental illness then is our environment, or our experiences, I think is probably a better way of talking about it. And so if we know that we have a greater degree of genetic vulnerability to developing a mental illness because we have a family history, let's say, that leads us to a position where we can think about trying to find ways to reduce our experience-based risk as a way of reducing our chances for developing psychiatric illness. And I kind of really don't like talking about it in such like vague and abstract terms. I wonder if I could talk a little bit about, I mean, I know you know about my JAR model for mental illness, David, but I was wondering if I, yeah, okay. So for other people who don't know this already, like David does, what we've developed like a visual analogy here. We actually have established in Vancouver the world's first specialist psychiatric genetic counselling clinic. And the point of that clinic is to help people who live with psychiatric illnesses and their families to understand what we know from research about what contributes to the development of these conditions, and to use that understanding as a framework for helping people to figure out what they can do to better protect their mental health. So if I was to distill what we do down into 2 sentences, it would be this. First, if you have mental illness, or if you have a loved one with mental illness, it's not your fault. It is absolutely not your fault. But there might be things that we can help you to do to better protect your mental health for the future. Okay, so both of those 2 things can be true at the same time. You know, having a psychiatric illness is absolutely not anybody's fault, but there are things that we might be able to do to better help your mental health for the future. So that's really the crux of what we're doing. And of course, when people, you know, as you might know, David, I don't know if we've ever really talked about this, but from experience, you know, you and I both having had psychiatric diagnoses that we may or may not agree with, but like, though receiving a diagnosis like that can make you feel all sorts of like messy, complicated things like guilt and shame, stigma, fear, all sorts of different things like that. And I know I've experienced some of that, and I know that I'm not alone in experiencing those things in relation to my diagnoses. And so in genetic counselling, what we're really trying to do is to uncover those kinds of emotions that people might be feeling in relation to their psychiatric illness, and using what we know from research about how these illnesses arise to hopefully try and mitigate some of that. So, and actually we've got data. So as you know, I'm a researcher. And so I'm very interested in studying whether this interaction that we're talking about called genetic counselling can actually help people. And it can. So we've got really robust data at this point showing that after receiving genetic counselling, people have very quite significantly increased levels of empowerment. So people feel like they're more able to, you know, to help themselves, to you know, have a sense of, you know, control over what's going on. They understand things better, etc. Yeah, and so that means a lot to me, that we can really we can see, you know, make those sorts of outcomes come true. So I don't know if you can I screen share to show people the JAR model instead of
we absolutely can give it a go.
Yeah, okay, let's try that. So I'm just gonna go and pull up my file. 1 second, because I've got some fancy new jars, David.
The other thing we can do is we can edit stuff in.
Perfect. Yeah,
as well. Well, I say we. Someone more skilled than I am can help me do that.
Fantastic. Okay, so let me share screen. Oh, it says host disabled participant.
I might need to make. Let me see if I can.
Okay, cool.
Really, will be pushing my ability to.
I believe in you, David. You've got this.
Allow. Oh God. Yeah, there's always the risk that I might simply just throw you out of the room in my random pressing.
That's okay.
Thank heavens for editing. That's all I can say.
Yeah.
Right. So if I press on you.
Yeah.
Make co-host.
Yeah. Perfect.
Okay. I think
I am now co-host. Yeah. Okay. And so now I can share.
Don't let it go to your head because there's only the two of us.
Perfect.
Ooh,
all right.
Yep.
Okay.
That's looking good.
Nice. Okay. So so this what I'm going to share with you now, David, is like this visual analogy that you know, but it's for everybody else who's watching, I'm sharing with us today. And it's a visual analogy that we've developed that we use to help people to better understand what we mean when we talk about genes and experiences working together, because I'm a kind of more visual person, and I find talking about it in these very abstract, nebulous terms kind of not that satisfying. And so this is just a way of helping people, myself included, to sort of engage with it really, and to give people language, I suppose, and tools to talk about it with others. So the concept really that we share with people is that everyone has a mental illness jar, everyone, and that in order to be experiencing an active episode of psychiatric illness, that jar has to be filled up to the top. And as we were just talking earlier about nature and nurture, or genes and experience, right? There are two different kinds of vulnerability factor that you can use to fill your jar. So we represent the genetic vulnerability factors with these orange balls, and we represent the environmental or experiential vulnerability factors with these blue pyramids. And so basically, what we know from research is that we all have a certain amount of genetic vulnerability to psychiatric illness in our jars, right? Every one of us. We can talk more about that in a minute. But so what you can see in these pictures, in this series of pictures, is that the amount of genetic vulnerability in that jar stays the same over time. And that absolutely reflects what we know from research. Like what you've got in terms of genetic vulnerability to this stuff, we can't do anything about that. Like it's just what you've got. But remember, the jar has to be full. in order for a person to experience an active episode of illness. And so it essentially, it's not that it doesn't matter, but what makes the jar full or not is what we experience in our lifetimes, right? The environmental or experiential things. So you can see in this representation that, you know, over the first little period of time here, we've got a few blue pyramids in the jar. So there is some environmental vulnerability entering the jar. So that could be things like, you know, childhood head injury is a thing that we know can contribute to certain types of the development of certain types of psychiatric illness in later life, for example. And then we've got here some more time, and at that point the jar has now accumulated enough of that blue triangle business, that the environmental or experiential stuff, that the jar's full. And that can be an accumulation of things like of all different kinds of stressful life events, and you know, there are certain things that we understand, like use of some kinds of drugs can increase a person's vulnerability, right? So we know about things like crystal meth and cannabis. If you use a lot of cannabis when you're very young, that's something that can increase your vulnerability to certain kinds of psychiatric illness later on a bit. So important to know that absolutely none of these things on its own causes mental illness, right? None of them on their own. These are all just things that increase vulnerability, such that the cumulative effect of them all together is that a jar can become full, and that's when somebody experiences first active episode of illness. So
could that include things like being bullied, kind of bereavement, life events, these kind of things?
Absolutely. So David, one of the things I find most interesting is that, you know, how, you know, because I said stressful life events, how on earth do we define that, right? And that's really the question that you're asking. You're asking me, is bullying a stressful life event? Is bereavement? Absolutely. So basically my take on how to define a stressful life event is that it's defined by you, right? It's a subjective definition. So my favorite example of this is that I have a trainee right now who has moved house 4 times in the 2 years that I've known her. Right, she doesn't actually mind. She finds it exciting and enjoyable. So she tells me. I find it difficult to believe, because for me, moving house is like a profoundly distressing experience. And I'm not joking. You know, my ideal way to move house would be to be sedated until it was over, and then, you know, I find it to be profoundly stressful. So some of these stressful life. So for my trainee, moving house wouldn't necessarily be a stressful thing for her, but for me, absolutely, it would be a massive pyramid in that jar for me. So these are very subjective, personal things, and so, you know, you would be the expert on what is stressful to you in this model, right?
Yep.
Cool. So one thing I mentioned was that we all have some genetic vulnerability to mental illness. We know this very clearly from all of the genetic research that's been done. And I think this is a profoundly important point, because, you know, as oftentimes what I find is that people who have a diagnosis of a psychiatric illness can end up feeling that they must be like biologically different or defective or something in some way. And that's absolute bullshit. Right? We all have some genetic vulnerability to these conditions. It just varies in terms of how much, right? So one thing I want people to look at here is that even if you've got a jar that starts out with a large amount of genetic vulnerability in it, right? That doesn't mean the jar has to fill all the way up to the top, ultimately. We can stop here, right? It doesn't have to go all the way to this end. Right, so that's point 1. Point 2 is that even if you have very little genetic vulnerability in your jar, the jar can provide, you know, if you experience enough things in your life that would, you know, you meet those criteria, then your jar can become full. So people can experience psychiatric illness in a whole variety, from a whole variety of different contributing factors, is what I'm saying, right? So I think that it can be really important, just from a stigma perspective, just to be aware that, like, while some people might have a jar that looks like this, there's going to, you know, if this is a normal distribution of how much genetic vulnerability we each have, there's going to be a few people up here who have a lot, a lot of genetic vulnerability in their jar. There's going to be a few people down here who have very little, but most of us are actually going to be somewhere in this moderate range. And so really it just depends what happens to us during our lifetimes that determines whether or not our jar fills up and we ultimately experience that episode of illness. Oh yeah, we don't need those. Okay, cool. And this is just a picture that was getting at what we were talking about earlier, David, about how you don't inherit mental illness itself. What you inherit is a vulnerability. So in this, let's say that you are this person down here, and your jar has become full all the way up to the top with those blue pyramids with that environmental stuff. But you're the first person in your family to experience mental illness. So you're like, well, how can genetics be a contributing factor to this? Because nobody else in my family is affected. But that's exactly what we would expect to see, because all it means when you say nobody else in my family has had mental illness, all it means is that you know their jar hasn't filled up to the top. That doesn't mean they have no genetic vulnerability, right? This is what your mum's and dad's jars might look like, but we don't know. Right, because their jar never filled up to the top with the environmental stuff. So we all have some genetic vulnerability to mental illness. That's a really key piece to remember. We already talked about that, how jars don't have to fill all the way up to the top, even if there's a lot of genetic stuff in there. But this is what I want to talk about, because to me, this is the best bit about being a genetic counsellor who specializes in psychiatric illness. Because, right, the thing is with psychiatric illness, even when you've had like even a really bad episode, like I've had some really bad episodes of depression, I would like to never have one again. They're that bad. Like that would be great, never to experience that again. So for me, I'm very keen on trying to identify ways and strategies that will reduce my risk of ever being there again, essentially. And so that's what's good about this part of the model, is that we really get into talking about that. And so the concept here is that there are protective factors that we can use that stack on top of our jar, as you can see here in the third panel, to make it taller so that the jar can accommodate more experiential crap without getting full, essentially. Because as I said, we can't do anything about the genetic stuff in our jars. That's just there. It's stuck there, right? And there are some things that we might be able to do about some of the environmental stuff, but not all of it, right? So for example, I talked about how there's evidence about cannabis use, for example. Using a lot of cannabis when you're young can increase your vulnerability for certain kinds of psychiatric illness. So theoretically, at least, what you could do there is, and I know this isn't trivial, but you could at least theoretically stop using cannabis. And maybe what that would do would be remove some of these blue pyramids from the jar, so reducing your environmental vulnerability. But there are other things that are environmental vulnerability factors that we can't change. Another thing I mentioned was, for example, childhood head injury. We cannot go back in time and change whether or not that happens. So if that's a blue thingy in the jar that you can't alter. And so that can be really scary, because then you're like, oh my God, what, then I had no control. But yeah, there is, because we can make our jars taller. And so when I'm talking about protective factors, I'm talking about things for which we have amazing evidence in terms of how it can protect your mental health. Things like sleep, exercise, nutrition, good social support networks, finding more effective ways to manage stress. These are all really profoundly helpful things that can act as rings to stack on top of the jar, making it taller. And as well, for people who've been diagnosed with a psychiatric illness, if you're lucky enough to find a medication that works well for you, like I have, then that can be a really important protective factor too. So there's all sorts of different things. So to me, this is, when we talked earlier, David, I was telling you about how we've got all this data that shows that having these conversations with people increases empowerment. This is, I think, why, because we're saying to people, well, yeah, you might have this greater vulnerability, but here's what you can do about it. And so people like that, because it gives you a sense of agency, a sense of like, not absolute control, but that you can influence your trajectory, right?
Yeah.
Maybe I'll shut up for a second.
So Can I ask some technical questions then?
Please.
Leave this up. How much do we know about these yellow ball levels? So what can we tell? I mean, when you're just looking at the family history, even if we knew the levels in mum and dad, that doesn't in itself tell us about the yellow ball levels, does it?
No, exactly right. So in the picture that I just showed you that had mum and dad's levels of balls and then 4 kids underneath, right? Each of the kids has got a different amount of balls from the same 2 parents, right? This is exactly what happens. So you're asking me, what do we know about what these balls in the jar are?
Yeah.
Okay. And so what I can tell you about that is that there are lots of different kinds of balls to start with. But let's talk about the smaller, because, okay, so some of the balls are bigger, right? Some balls make a bigger contribution to our level of vulnerability. Most of them that, you know, all of us will have some of, each of them individually only makes a teensy difference to our level of vulnerability, right? And those ones, in genetic circles, they call them single nucleotide polymorphisms, which is a bit of a mouthful. And then that gets
SNPs.
A SNP, exactly. Gets abbreviated to SNP. And all that means is that it's, if you're thinking about the DNA strand, a single nucleotide polymorphism is like the smallest type of genetic difference that you can imagine. It's literally one single DNA molecule bit being exchanged for another one. That's all it is, right? So it's a tiny difference. We're all going to have dozens and dozens and dozens of differences like this. Every single one of us will have those. And that's why we can say with such confidence that we all have some genetic vulnerability to mental illness, because the SNPs that we were just talking about that can contribute to vulnerability are so common in the population that we will all have some of them, right? So that's one kind of ball in the jar. Another kind of ball in the jar would be this kind of ball, right? So that it's a genetic difference that makes a bigger contribution to our vulnerability. And so we've actually found that these are actually relatively common in the population too. You know, in genetic circles, they're referred to as copy number variations, or a CNV. And what those typically are is like a small chunk of DNA being deleted or being duplicated, right? So it's copy number variation because it's more or less copies of that chunk of DNA. And so really important to know that even if you have one of those, it doesn't cause mental illness, right? Even if you've got one of those, and even these are relatively common in the population, just not as common as the SNPs that we were just talking about. So even those, they do not fill up the jar, right? They make a greater contribution to vulnerability, but still don't cause mental illness. So the role of our experiences is still really important. Yeah.
Excellent. So going back to how this fits into public mental health.
Yes.
One of the things that's important in public mental health is recognizing vulnerability or groups that are more at risk of, in public health, a particular health condition, in public mental health, poor mental health, and that might be mental ill health, or it might just be poor mental health, and that's a whole another discussion. But what I take from this is that there is potentially a role in genetics for identifying increased vulnerability, increased risk to developing poor mental health or mental ill health, however you want to describe it.
Yes.
And what that says to me is I should be concentrating on these. I'm pointing, which is futile on this. I'm pointing at your jar extension. So one of the things that we at the Mental Health Foundation are interested in is identifying people who are at elevated risk of poor mental health or more vulnerable. And we know quite a bit about social determinants. We know quite a few things about. We know much less about those genetic determinants.
Yes.
And this is the bit I think that those of us that don't understand the genes so much, worry about.
Yes.
And one of the things that I've always enjoyed about listening to you is those conversations you have with people who want to really explore that genetic component to the extent of they're thinking about having a genetic test.
Yes.
So, and I know this is at the core of quite a bit of what you do, isn't it? Preparing people whether that is or isn't a good decision to make, and how they should understand that. Could you talk a little bit about that?
Yeah, I absolutely can. Do you mind if I just very quickly address this picture first? Because this is where
please do.
I misinterpreted where you were going to go. But the only point I wanted to make here was about how, from a public mental health perspective, what this picture is really trying to get at is how you do not have to wait for your jar to get full before you start engaging with protective factors, right? So if we know that you are at increased risk or you have greater vulnerability for developing a psychiatric illness, for example, because you have a family history, right? That doesn't mean that we just have to sit around and wait for it to happen, right? Because first of all, it's not a foregone conclusion. And second of all, there are things that you can do to protect your mental health before the jar even gets full, right? So those things that we were just talking about, sleeping, eating, exercise, social support networks, finding more effective ways of managing stress, those are all things that you can do before your jar gets full to protect your mental health proactively, right? So that was what I wanted to just quickly mention. But yeah, so let's get back to the question that you asked me, which was about genetic testing. So the first thing to know about genetic testing for psychiatric illness is that there really isn't very much that's being offered to people routinely in a clinical setting at the moment. And the reason that there's not much that's being offered to people routinely in a clinical setting is because there isn't very much that makes sense to offer, because it doesn't tell us very much, right? So I talked briefly about those big orange balls in the jar, the copy number variations. Some people are suggesting that we should be testing everybody with schizophrenia to see if they have those any of those big balls in the jar. And so that's a matter of active debate in the psychiatric genetics and the clinical community at the moment. But what I want you to remember is that even if we did identify something like that, a copy number variation in somebody who has schizophrenia, that doesn't explain the reason why they have schizophrenia, because there is no single reason, right? Even if there is a CNV, even if there's one of those big orange balls, then there's still a really important role for our experiences, the environment, all of that business, right? So genetics does not cause mental illness. There is no genetic test with which to establish a psychiatric diagnosis, to refine a psychiatric diagnosis, to confirm a psychiatric diagnosis. There's no genetic testing to do any of those things, okay? So all that genetic testing can offer us at the moment, whether it is for those CNVs, the big orange balls, or for the smaller ones, the single nucleotide polymorphisms, the SNPs, all genetic testing can offer us in the context of psychiatric illness at the moment is whether you might be at higher risk or lower risk, right? And so let's talk, but so some people might be listening going, yes, but I want to know. And sure, absolutely, as is your right, should you want to. There are, we live in a capitalist society, and when there is a demand for something, then sorry, my partner's just wandering around in the background. When there is a demand for something, then people will supply. And so indeed, that is the case. So there are places that you can go to on the internet where you can send your raw genomic data sequence. So for example, if you submitted a spit sample to 23andMe or to Ancestry or something like that, you can actually download your raw DNA file, and then you can send it to one of these companies, and they will look at all of those single nucleotide polymorphisms, the SNPs that we were talking about, and they will generate what's called a polygenic risk score, okay, which is all that is a sum total of all of those tiny genetic variations added up together. Because as we were discussing, like, each one of them on their own is meaningless. It makes such a tiny difference that who cares? But the theory goes, what about if you add them all together? Surely that would tell you more, right? And so that's what these companies are doing. And so you can absolutely get yourself one of those if you so choose. But what I will tell you is that for schizophrenia, which is the condition about which we know the most in terms of these polygenic risk scores, the very best test that we can produce for you explains a total of about 10% of a person's overall liability for developing schizophrenia. So that means that there's 90% of the reason why somebody might develop schizophrenia that's completely unexplained by this genetic test. So whether or not you think that's useful is going to be subjective, right? For me, I look at that and using my value system and the way I think about things, that doesn't feel useful to me. But I'm a genetic counsellor, and I've interacted with lots of people over the years who say, no, I understand what you're saying to me. I understand the limitations of this, but I would really like to know. I would really like to have that information. So those are the things that genetic counsellors can help people with. So in the end, I think from the genetic counsellor perspective, what we're here to do is to support and promote each individual that we're interacting with in terms of their autonomy in healthcare decision making. So for me as a genetic counsellor, the best outcome from a conversation like that is a person making an informed decision based on their values about what's right for them in terms of whether or not they want a genetic test. That's the best outcome for me. I don't care whether it's yes test or no test. What I care about is this the right decision for them based on all of the information and based on their values? Yeah.
So if we know in the UK, for example, we have grand designs on biobanks.
Yeah.
And the rationale for that is that will help inform health policy, that will help identify what the people of the UK are most likely to get unwell with, who might be more or less likely to get that, and therefore what we should prepare in the way of services, and maybe if you're progressive thinking, what we can do in the way of prevention. How realistic would you say that is in terms of mental health, mental ill health, if you like?
Yeah, okay. So here's the thing. So all of the things that we've talked about in terms of things that we can do to reduce our chance of developing psychiatric illness in the first place, or to reduce our chances of having a relapse if we've already had a full jar and we've already experienced an episode of mental illness, all of those things that we can do to protect mental health, they are not dependent on having had a genetic test, right? So the problem is, though, that when you say to somebody, hey, sleeping, eating, exercise, that's all really important for protecting your mental health, people go, yawn, yeah, we know that. Right. And so it's not particularly engaging, I suppose. But what we found, as I was telling you earlier, is that the genetic counselling that we provide for people does empower people, and it does look like that after receiving genetic counselling, people do engage in additional behaviours to protect their mental health. And so why? Well, I think that's because we're not just saying at the population level, hey everyone, you should sleep well, you should eat well, you should exercise. We're saying, hey, David, you've told me that you've experienced an episode of depression and you fucking hated it, and you would like to avoid having another episode of depression. Cool, I understand that. So here's what we know about what contributes to an episode of depression, and here's what we know about things that you can protect your mental health. Have you noticed anything about, like, for example, how your mood might dip after you've had several nights of really poor sleep? You have? Okay, cool. So then maybe we can use that as a protective strategy for you. That maybe good quality, prioritizing good quality, regular sleep is a thing that could help you personally protect your mental health. Do you know what I mean? That kind of thing.
Yeah.
And we're talking to people about exercise. I'm not just randomly shouting exercise at people. I'm saying, so David, you know, like, is there any kind of exercise that you've found that works for you, that makes you feel better? Because, for example, for me, I hate running, hate with a passion. It doesn't do anything good for my mental health. It just makes me frustrated and angry. However, I really enjoy weightlifting. And so for me, weightlifting is a thing. It might be as simple, and we also have to work with people's abilities and disabilities, right? So if you use a wheelchair, then going for a walk may not be a thing, but you know, going out for a roll might be a thing. Like, so there's all sorts of different ways. Going for a swim may be your favorite thing. So it's a matter of identifying those things that you have noticed make a difference to your mental state and helping you figure out ways to prioritize making that happen, essentially. Right? So it's very much personalized.
So in a sense, part of what you're saying is I may come to you because, you know, I was one of those strange people. When I was a young boy, I wanted to grow up to be an actuary. So you know, risks and numbers is my kind of thing. And I come along to talk to you, and I want to find out about my genes.
Yeah.
Because I want to understand everything about me. And you know, I was the kind of boy that took everything apart and tried to put it together again. And sometimes it worked, and 9 times out of 10 it probably didn't. But so part of the, you know, the real value of that of the work that you do is understanding people's interest, and then you know, having an intelligent conversation that helps them make up their own mind.
That's exactly it. Yes.
And that kind of, you know, that just is empowering, isn't it? I mean, that must be almost as empowering for you as it is for them in a way.
I love it. I find it to be one of the most, you know, exciting things. You know, I mean, I think for lots of us who work in healthcare, you know, you go into this because you want to make a positive difference for people. And, you know, I see it so often when I'm having these conversations with people about this stuff that, it's incredibly rewarding. And I wish that what we do here, the psychiatric genetic counselling that we offer for people, I passionately wish that was available to more people, because I've seen firsthand the real difference that it makes. I mean, so that's partly why I'm so excited to be able to have this conversation with you today.
Are there any kind of final thoughts that you would like? I mean, a lot of people listening and watching won't be familiar with genetics in that kind of detail. Won't maybe not even have heard of psychiatric genetic counselling. What would be the big things that you'd want people to take away from today to think about? You know, if they're working in mental health, if they're kind of in that public mental health space, and they're trying to improve mental health within their communities, what are the big things that you want them to take away?
Okay, so I think for people who are working with people who have psychiatric illness, I would like to encourage you to consider that these conversations about why do I have this psychiatric illness, why me, right? That's kind of an existential question, and it's something that we have not historically paid very much attention to. We tend to focus on crisis intervention, medication management, you know, finding social support systems, which is all so critical and, you know, desperately important. But this is important too. It really is. I've seen how because of helping somebody to better understand how genes and experience contribute together to the development of illness, people have realized that, oh, okay, so if there's a biological contribution to my illness, then maybe that biological treatment that people keep suggesting might actually make sense for me, you know, as in psychotropic medications. And then, you know, I've seen people do much better in terms of their mental health as a result of having psychiatric genetic counselling conversations. You know, for people who live with psychiatric illness themselves like me, and they're thinking, oh, that sounds kind of interesting. I wouldn't mind talking to somebody about like how all these concepts apply to me and my family, then great. You know, there are genetic counselors all over the world now. And, you know, so have a Google, see what's available in your country. In the UK, which is where you are, there's the Association of Genetic Nurses and Counsellors. That's a good place to start. If you're in North America, there's the National Society of Genetic Counsellors, a great place to find people, but there are counsellors around the world. So have a Google and have a look at that.
And we'll make some links available to people.
Great, yeah.
To go out with the broadcast.
Yeah, so those are, I think, the main things. And I think just the big thing, if you only take one thing away from today, and you are somebody who lives with psychiatric illness, or you have a loved one with psychiatric illness, the thing I want you to know is that it's not your fault. It is absolutely not your fault that this is something that you're dealing with. But there is also hope. You know, there might be things that we can better do to help you protect your mental health for the future. And that's what I want to leave people with, I think.